Hi, I'm Jim Bochsler. I'm the Vice President and Medical Director for Peace Health Medical Group here in Bellingham. And I'm also, importantly, still a practicing pediatrician. And I wanted to talk to you a little bit today about how we're keeping ourselves safe here and how we try and keep everyone in our community safe as they come to us for care. So I'm going to start by putting on a mask because that's what we're all doing now during this time of COVID. And so I'm cleaning my hands before I touch my mask. I'm going to get it on. And then clean my hands once more. And that's how we are doing it. Everybody here in Peace Health Medical Group every day. So part of the message I want to get to everybody, and all of us as providers want to give, is that things have changed a lot. We know that a month, 6 weeks ago, when COVID first came into our communities, we were trying to keep everybody at home. We were trying to decrease the number of people coming to our offices. And we know that that's been really important. People staying at home has really helped us in multiple ways. It's helped decrease the incidence of the disease in our community down to a level that we think is much better than it was even 3 or 4 weeks ago. But it also forced us to make changes that I think have made this building and all of our clinics safer than they've ever been to come into. We now screen everybody for symptoms and fever before they come into our buildings. We've decreased the number of people accompanying our patients to decrease that possibility of spreading infection. And like with me with my mask, all of our caregivers in Peace Health Medical Group are wearing masks all day. And we're asking all of our patients to come with masks. And we try and provide a mask for everyone. We also have, importantly, segregated our clinics and our buildings so that we can keep people who have diseases or symptoms that may be COVID or other infectious diseases into certain areas, and made the other parts of our clinics and our buildings safe for those who don't have symptoms that are concerning for that. In fact, we've even done that with our testing. When we're testing for COVID, we're doing it outside of our buildings now and not in our clinics. And I think that's been really important. It does require a doctor's order or a physician's or a provider's order, but it's available and much more widely available than it was before. One other thing that I want everybody to know that we've added to how we can deliver care in Peace Health Medical Group, and I know this has also been a part of what's happened with many of our other providers in our community, is adding video care. So here we have a setup where I can talk with a patient or with anybody else using a common platform called Zoom. Our Zoom is different than the one that other people use. It's a healthcare related Zoom that does not allow recording and is completely encrypted, so it keeps all of this confidential. We think that this is a really important addition to how we can care for patients. And like with everything else, touching base with your provider and asking them, could video visits work for my problem? It may or it may not. But it is something that we can use as a choice to keep you as safe as we can while we take care of all of your healthcare needs. As a primary care physician, I think it's really important that everyone not delay the care that they need. To maintain the best health possible, it's really important to keep that strong relationship with your primary care provider and to come for the care that they recommend and that's needed. We are starting to see more illnesses in our emergency rooms that are a little higher acuity from problems that have not been taken care of over the last 6 weeks, and we do not want that to happen to any of our patients. I think it's extremely important that we continue to get scheduled care, such as vaccines. As a pediatrician, I do not want to see us get through the COVID epidemic and then have epidemics of vaccine preventable illnesses like whooping cough or measles come and make our kids and our families sick. We just don't want that to happen. And so please take advantage of all of the things that we've done here and that all of the providers in our communities have done to make it safe for you and your family to come to see us for care so that we can do our best to work together with you to keep you healthy.